The second exercise in this mid-back mobility series is focused on the twisting or rotation capacity for our mid to upper back. So again, the mid-back is the area where a lot of people tend to lose a lot of mobility just because of today's modern society. And the first exercise we went over, which is the cat, aims to help restore the backward bending, or also known as the extension movement of the mid-back. The second exercise is going to really focus on the twisting or the rotational aspect of the mid to upper back. So we're going to demonstrate. So Twee's going to demonstrate that next. So first off, Twee, go ahead and lie on your side with your knees bent, just like so. Okay. So you want to have your knees bent up almost as high as you can. It doesn't have to be all the way up towards your chest, but just maybe a little bit higher than your hips. And you want to use this this bottom hand. So if she's going to be laying on her right side, she wants to use her right hand just to kind of block on top of her hips here, because as she twists, we want to make sure that her hip stays centered and her lower back also stays anchored, because we really want to be stretching and opening up into this mid to upper back region through here. Okay, so the next thing she's going to do is she's going to slowly twist and open her arm like a book, because we call this the open book stretch. Go ahead and twist and turn your head into the direction where you want to turn. Okay. And what you should feel is just a stretching and just a sensation through her mid-back, or even a stretch and sensation in her chest and her arm here. For a lot of people, when they get to about this point, you're going to start to feel a lot of stretching, a lot of just kind of stiffness, hopefully through this mid to upper back and through the shoulder region. Once you start to feel that, that's where the exercise begins. Once you start to feel that stretch, take a nice deep breath in. Exhale and just slowly let your arm relax down to a little bit further, right to about here. Hold it there, take a couple of short breaths. Now take a deep breath in. Exhale, and let that exhale just drive you down a little further, as far as you can. Good. So you want to make sure that you're trying to open up your chest as much as you can, and the goal is for you to be able to touch your hand and touch your forearm or touch your elbow all the way to the ground. Breathe in, exhale, and hold it there. We're going to do it 2 more times, okay? For a lot of people, you may not be able to hit the floor in the first time. That's okay. So long as over time, this might take days, this might take weeks, it might even take a couple of months for you to get full range like Twee is right now. Breathe in, breathe out, and just relax. But that's what we talk about, just slow, consistent effort over time, not pushing past your limits, but just identifying and using these exercises as a means to identify where your limits are, and then slowly start to work towards where you need to get to over time. One last one. Deep breath in, exhale, and try to get that shoulder all the way to the floor now. Where do you feel that?
My shoulder down to my arm.
Good. How about through here? A little bit?
A little bit.
Okay. She's pretty mobile up through there, so she might not feel as much of a stretch as she does through here. But for a lot of people that do have a lot of mid to upper back stiffness, it is normal for you to feel kind of that stretching and some of that pull and some of that sensation through this mid to upper back. If you do start to feel a lot of pain in your lower back, or if you start to feel pain in your hip, then again, back off a little bit, try to reset, and really try to center your focus and your effort on feeling this mid to upper back moving, and also the shoulder stretching here in the top here. All right, let's have you reset to the beginning. All right, so we had her hold that stretch a little longer than I typically would have you on your own, but you want to try to go through 5 different breath cycles and just very slowly try to get your arm to be able to touch the floor. And then once you've done those 5 breath cycles, then just turn around, switch sides, and do the other shoulder. So that's it for the open book exercise.